Masturbation. It's a big one. I'm probably going to get a few people annoyed. Let's take a candid, science-backed look at topics that matter, even the ones that people shy away from. And for some, masturbation will be a normal part of life, and for others, it can bring confusion, guilt, and even shame. Today, we're going to break it all down. We're going to look at some of the pros, some of the cons, some of the health practices, and how to approach it with both balance and understanding. So we're going to touch on edging, pelvic floor exercises, and male bonding, and how to manage social or sexual anxiety in and around the whole conversation about masturbation. Let's start with some of the benefits, because there are some. First and foremost, people use masturbation for stress relief. It releases endorphins and oxytocin, helping you to relax and reduce the amount of stress. It can help improve sleep. So post-orgasm relaxation can help you drift off faster and improve sleep quality. It can boost prostate health. Some studies suggest regular ejaculation may lower the risk of benign prostatic hyperplasia and prostate cancer by flushing out potential carcinogens by up to 21 times a month, which would certainly change the prescriptions here in clinic. It can also help improve sexual self-awareness. So this is masturbation will help you learn what feels good in your body and improve your experience with a partner. You know what works for you, and then you can discuss what works for the partner. It can help with pain relief. So orgasms can alleviate mild pain, such as headaches, and it can help boost your mood. Dopamine is released during climax, which can combat anxiety and depression. Now, the downsides of masturbation, because there are some, and let's keep it real, there are some real potential drawbacks to this. First and foremost is addiction and overuse. Now, if masturbation starts interfering with your daily life, your relationships, or your responsibilities, then that can become a problem. Overuse can desensitize you, making your partner and the intimacy with them much less satisfying. You can end up suffering from premature ejaculation because rapid masturbation techniques can condition your body to climax quickly, which might carry over into partnered sex. And then there's the shame and the guilt. So depending on your cultural or religious background or personal beliefs, it can lead to feelings of shame, which will harm your mental health and your self-esteem. And then there is physical irritation, where too much can cause soreness, skin irritation, or even bruising. And you can become dependent on things such as pornography. If masturbation is tied to porn use, then it can distort perceptions of sex and of intimacy. And excessive porn can negatively impact satisfaction and connection with your partner. Now remember, you can masturbate without porn, even without lustful thoughts. It's not always about fantasy. Sometimes it's just about stress release or about helping you get to sleep. Now, let's talk a little bit about edging. Edging is a practice of delaying orgasm or stopping the ejaculation and then trying to start masturbating again. So it's got its own set of pros and cons. The benefits of this are that it can improve stamina. You build endurance that can last longer during partnered sex. It can heighten pleasure because delaying climax can make the eventual release much more intense. It can help with mindfulness because edging encourages you to focus on the sensation and the process, not just the finishing line. And it can help with your pelvic floor strength. That start-stop nature helps strengthen those crucial pelvic muscles. The drawbacks are that by overdoing it, you can lead to discomfort or a sense of letdown if the orgasm is repeatedly denied. It can lead to overstimulation. Long sessions can cause soreness and reduced sensitivity, and it can lead to dependency where you rely on edging to make regular sexual experiences satisfying. Now, beyond both masturbation or edging, there are other ways to support your sexual health. The first and foremost would be pelvic floor exercises, Kegel exercises to improve muscle tone, blood flow, and erectile function and control over ejaculation. Now, I want to touch on social confidence and male bonding. Isolation can really amplify shame and anxiety unless this topic is talked about. And it's certainly something that I've seen over the decades of being in both ministry and discipleship and working with men is that we need to be comfortable talking about sexual activity, sexual health, masturbation, what's normal, what's not normal, and make it part and parcel of supportive friendships, opening up a conversation to boost mental health and resilience. That will help you address things such as the shame and the addiction. And it will allow you opportunities for you to talk about masturbation if it's starting to interfere with your life. Interestingly, also, being with other men and the camaraderie that comes with men actually boosts testosterone. Now, if you recognize the pattern, if it's harming your relationships or your mental health, then you do need to take a step back and assess your habits, set boundaries, limit the time and the frequency, find healthier outlets for stress, and try and find exercise or hobbies that are another way to boost testosterone and find a release. You can try therapy and counseling if shame and addiction is part of the underlying issue, but communicate, whether it's to other men in your life or to your partner, openly about any habits you might have and any concerns you have. Now, for some people, there is a spiritual angle, wondering if masturbation or edging aligns with your beliefs. And it's a deeply, deeply personal one. If you're struggling with shame or guilt, then remember just to respect and understand the body that has been created. Condemnation is not the same as self-care. And whenever you look across the animal kingdom, masturbation and edging are naturally seen as common practices. It's about what people are doing with it and often what's associated with it. So if there's an addiction to porn with it, that could lead to the shame rather than the act of masturbation in and of itself. The key is balance, awareness, and a little bit of self-compassion and self-love. So clearly, whenever it comes to masturbation, you don't need herbs to help with that. There are certainly herbs that are going to help with libido, but it's an important conversation in and around men's health that we need to have. And as you can see, because it's preventative of certain conditions such as benign enlarged prostate and prostate cancer, there's even opportunities for you to encourage talking about this and the practice of it in some patients. Also, with sexual performance anxiety, getting comfortable with your own skin is to be recommended. So that's it for now. Not particularly herbal today, but definitely relevant to all men. You take care. Do like, subscribe, and share this channel. Cheers.